And all kind of reasons that costs are increasing. And that's probably, in all seriousness, what it is certainly one of the primary driving factors behind the recent discussion to manage care. Remember, our little part of Medicaid is less than $1 billion now. It's about $800 million. When we were at our the year that we spent the most, we spent about $950 million. So we've never quite made it to $1 billion. I believe that program is an $18 billion program, so we're not necessarily where the real money is, although it is a lot of money, and although our system was experiencing steady cost increases. And our Medicaid waiver program, just so you all understand, the waiver is an optional program. States don't have to offer it. States are very well advised to offer a waiver because the alternative to a waiver is an institution. In fact, the word waiver, it's called a waiver because the person who has accepted that waiver slot has given up their right to seek placement in an institution. So they have waived their right to seek placement in an institution. So when the legislature implemented this waiver program, they did so, I'm sorry ma'am, I'll try to hold this closer. They did so with the thought that they could very precisely control costs by just telling the agency, just cut people off when you reach a certain limit. And of course, there have been court decisions that have come along since then that basically the agency can't do that. Once you're enrolled, if the service is determined medically necessary, we pay for it whether the money's in our budget or not. Therefore, we've had some deficits whenever the program was not adequately funded. So we are experiencing these kinds of cost increases, or we were. Now, interestingly enough, last year we spent less than what we spent in fiscal year 2006-07. Okay, so we're probably one of the only Medicaid programs where we actually are currently spending less. But Medicaid in general has continued to grow. Our program has continued to run modest deficits because they cut our budget more than what we've been able to reduce the spending through the implementation of the four-tiered waiver system and all of the other reforms that the legislature has put in place. The service eliminations, some of the service limitations, the price level, or the rate reductions for providers. But still there is a perception that there are problems with the spending in Medicaid. And certainly if you look at the big picture Medicaid, they're correct. That program has grown. I worked for the legislature prior to joining the Agency for Persons with Disabilities. I worked for the House of Representatives, the Appropriations Committee, for 19 years. I did the Medicaid budget. Back in the late 80s, we were telling the members, Medicaid, in fact, one of my colleagues did a presentation, and this is going to be something that means maybe something to the older people here. We called it the Pac-Man eating the state budget because it was growing back then. That was 20 years ago. It's still growing like that today. So that's driving a lot of this conversation. And that's a legitimate concern for policymakers. Remember, they ran on platforms that they were going to lower taxes, not raise taxes. They ran on platforms that they were going to cut government spending, not increase government spending. But with Medicaid, they don't have much of a choice. Because Medicaid, if a state opts into Medicaid at all, and Medicaid, believe it or not, is an optional state program. The whole thing, the state of Florida could make a decision, we're not going to have a Medicaid program here. They could. Now, what's the likelihood of that, given that they would lose about $10 billion worth of federal money? Given that your hospitals then would become basically run over with uncompensated care? Probably not too likely. But it's at least a possibility. But if you opt in, if you take the federal money, you also take a lot of the strings that attach to that, and that is that Medicaid, outside of programs like our waiver, outside of some optional services, Medicaid is an entitlement for anybody who is eligible. One of the key differences with our waiver is that we can have a waiting list. We don't have to enroll everybody in the waiver as a state. But once you're enrolled in that waiver, you get the benefit package that the federal government has approved. So you have the escalating cost of health care. That has been an issue in this country for decades now. It's not a new issue. People continue to look for ways to try to rein in the ever-increasing cost of health care. And certainly managed care is being presented as an alternative that will rein in these ever-increasing costs. You have the managed care industry itself. They are a growth industry just like anything else, and Medicaid, of course, is one of those frontiers. So there is political pressure being brought in the halls of the Capitol by the managed care industry. You have all of the uncertainty, and to some policymakers, what is the fear of the recent national health care reform? How will that drive costs?